first of all, really, how we define infertility and when should we start worry? And it's interesting because a lot of couples are coming now, and it can be confusing. They come in and they don't have infertility, or they truly have and they don't know it. The definition of infertility is 1 year of unprotected, actually regular intercourse. And the reason why, we point out unprotected and regular intercourse because, if the couple have been trying for 1 year, but one is in New Zealand and the other one is in Nevada, and they meet each other twice a year, that doesn't count. It's also, and I've talked a little bit about the previous webinar about a week ago, so it's very important to ask patients when they come to you. Usually they tell you, oh, we've been trying for about, 10 months, and I've mentioned it before, so if you hear it again, I apologize. That's for whoever wasn't in that webinar. Very important to ask, one, what do they mean by real trying? So I always ask them, okay, you've been trying for 1 year. How long have you been together? Well, we've been together for 7 years, and those 7 years have you used contraception? We actually didn't. Were you trying to avoid pregnancy? Well, not really, but we didn't aim it. Were you having regular intercourse? Yes. So it turned out sometimes that what they describe as, oh, we've been really trying for 1 year, their infertility might be actually six or 7 years. And the reason why it's so important to understand exactly how long it's been going on, because the duration of infertility is also a prognostic factor, meaning the severity is much more if a couple has been trying to get pregnant for 7 or 9 years as opposed to 1 year. So duration is very important. For women that are 35 and above, we always recommend doing the infertility testing after 6 months. Now, they won't be defined as, oh, you have infertility because once you turn 35, after 6 months, it's counted as infertility. The reason why we ask them to do that, because we really don't want women to waste time once they get to age 35. The other exceptions are, of course, women that, for example, have irregular periods. So if they know they come off the birth control pills and they have irregular periods, there is no reason for them to wait a whole year before trying to get pregnant, come to the fertility specialist or the OBGYN. If they get periods every 6 months and it's clearly infertility, and it will be a waste of time to wait a whole year. What we see happening much more, which I think is great, is patients coming in just for fertility testing. So those are either couples that are about to get married, sometimes it's a second marriage, or they get married and are older, and they said, you know what, I'm now 38 or 39, I'm getting married, I really don't want to have a child right away. We want to travel, we want to enjoy our life and so on, but we want to make sure that everything is okay. Or we have couples that say, you know what, we are getting married, we want to try right away, but we want to see that there is no problem, so we won't be wasting time. So I really think that there is nothing wrong about doing fertility testing at any age almost if you are delaying childbearing. Because, if everything is okay, then we'll tell you it's great, no worries, you have time, take your time. But if there is a problem, the earlier we know, the better, because it might change the family planning. If somebody knows that their fertility is decreasing, they might decide to have children a little bit earlier. Or if there is something that we need to improve, whether it's surgical or sperm or so on, it gives us enough time to do it. So I think it's very legitimate to do fertility testing without the need to be diagnosed as infertility. And the same with acupuncture. I think that it makes a lot of sense to, and I truly respect if a lot of you, some of you feel differently about it, but also have a Western diagnosis, because, for example, if the patient cannot get pregnant because her tubes are scarred, and I know there are some theories about acupuncture that might be able to open, but in reality, the chance of opening scarred tubes is not high. So then, we need to know what to do. So definitely recommend to do some fertility testing.